Welcome back to another episode of the Braun Performance and Rehab Podcast. Joining me today is Dr. Matt Hubbard. Matt and I are going to be diving into considerations for working with the handball athlete. So we dive into what handball is as a sport, what it entails from a competitive sense, the kind of injuries Matt typically sees when he's working with the US Handball team. We talk about how he manages those injuries, and we talk about so many other things, including how handball could even be applied to other sports as a great GPP tool. Episodes like this are made possible by ISOFIT. ISOFIT is our go-to for all things isometric strength training. Enjoy. Matt, welcome to the podcast. I'm super excited to work with you today. Thank you so much for being here, man.
Absolutely. Great to be here. So I am a sports physical therapist here in Dallas, and been in the orthopedic and sports world since I got done with school and my residency. I've been here in Dallas for about 11 years. Been working with Southern Methodist University Athletics for a little over 10 years. And then recently, within the last 3 years, started getting involved with USA team handball and beach handball.
That's interesting on the handball side of things there, Matt, because I don't meet a whole lot of people who even know what handball is or work with handball athletes and that sort of thing that way. And it's funny because, we talk about the sports and the athletes that we see in clinic all the time. And usually handball is one that PTs are like, oh, yeah, I have no idea what that is, or I've never treated a handball athlete before. So how did you get roped into this handball world? Did you grow up playing handball yourself that way, or?
I had never heard of it. Then when I was in college up at Oklahoma State, they added it in as an intramural sport. So me and my buddies were like, okay, this seems like fun. We jumped in and had a blast doing it. So much so that one of my buddies we played it for his bachelor party before his wedding.
Really?
Yeah, we just had a blast with it. And that was pretty much it. Played it for a couple of years as an intramural sport. And then fast forward to about 7 or 8 years ago, and had a patient, and we were just chatting on her first day, and she was actually the mother of one of the girls I worked with, and she mentioned that she played handball and was involved with the women's national team back in the early 80s, and it's like, well, I played handball as an intramural sport. I had a blast with it. And she said, well, that it's still around, and if you're interested in helping out, we could always use somebody. And it's kind of blossomed from there.
That's so interesting because we have the conversation all the time about the importance of the subjective and actually getting to know your patients. And it's interesting to hear that led to the opportunity to work with, a large organization that way. So for the clinicians listening, I harp on the importance of the subjective all the time for a variety of reasons, but realize that it can even open up doors for you, doors that you might not have even known existed in the first place. And I think that's so interesting too, that, like you said, you played it a little bit at an IM level, and now you're working with athletes who treat this just the same intensity and same competitiveness level that we often think about with like a lacrosse or a football or some of these major sports that way. Is, it's really one of those things that I think the people that are into it, and there's a lot of passion surrounding the sport for those who play it regularly. And I think that you referencing that, your buddy's bachelor party involved handball is a great example of that. Like most people are not thinking about like, going out and, throwing the lacrosse ball around with some sticks or like doing a box game for their bachelor party. But the fact that he's willing to throw handball in there is really unique to me that way. As far as the sport itself, for people who aren't familiar with it, what does the sport look like? How is it broken down? And you mentioned that there's multiple different disciplines or teams underneath that handball umbrella. So what all does that look like, Matt?
So you have indoor handball and beach handball. Beach was actually a recent addition for me, but to go back to indoor, one of the best ways I can describe it is similar to water polo on a court. So you've got a court that's a little bigger than a basketball court. You've got goals that are around the same size as an indoor soccer goal, and you've got almost like a 3-point line. I believe it's a 9-meter line, if I remember correctly. So it's almost like a 3-point line of basketball. And then from there, it really is kind of a combination of a ton of different things. So you've got the aspect of water polo where you're moving around. Similar with basketball, you're setting picks, you're moving off of each other. You've only got so many steps you can take before you have to dribble or pass, but you've got a line that you have to shoot behind. So you can't get all the way to the goal like you could in a basketball or a soccer. You've got to shoot from outside, and it's a fast paced, high contact game, and it's getting a few more eyeballs on it. I think this most recent Paris Olympics, they actually had better viewership than they have probably before, especially with the way we consume sports and we consume media now, that there were so many streaming options that just about every sport in the Olympics this year was able to get its own platform, so to speak. And so and handball also being a huge thing in France, they were able to kind of showcase it a little bit. So that's a pretty long-winded answer for how the indoor game kind of moves around.
Yeah, but there's a lot to unpack with that. And I mean, I think that from everything you just explained, it sounds like it has the recipe to really be like the next big sport. Like I think about just how much pickleball has boomed over the last 3 years, where like, 5, 10 years ago, no one heard of freaking pickleball before. And now it's like the thing. And in the back of my mind, I'm like, handball, we have an indoor option and a beach option. So that's a good thing. We have a lot of contact and we have a lot of fast-paced movement and a lot of scoring. So all of those things to me just seem like the kind of thing that most people are looking for in a sport that way.
Yep, I totally agree. I mean, it really is, there's not really any downtime. So like if you have experience playing soccer, most of the time you've probably played indoor soccer and outdoor soccer. And from my experience, indoor soccer was always much more fun. It was faster. There was a lot more going on. It was more high scoring. I just loved indoor much more than outdoor when I was playing. And so you take those kinds of things, the things that we enjoy watching. Like you said, that's high scoring. We enjoy watching goals. We enjoy people scoring goals. That's how you win games. We love that kind of stuff. So being able to watch these athletes move around and throw this weighted ball with really high force, and watching these goalies attempt to try to stop this thing when it's right on top of them, and it's a lot of fun to watch. It's fun to play. It's fun to experience, and like I said, it's got all the things that we like here when we're consuming sports.
How does the indoor version differ from the beach version that way? Is there like a different number of athletes on the field at a time, or what does the difference there look like?
So it's a much smaller courts, and I'm gonna date myself a little bit here. I was never exposed to it, but a long time ago, you used to have 6-on-6 basketball, especially for women. My mom played 6-on-6 basketball, and so essentially, from what I remember being told, you had 3 defenders on each side of the court, and then you had 3 offensive players. And when the defense would get the ball, it would go to the other side of the court, and only so many people could move across the court at the same time. Beach has a similar thing to that. So you can only have so many people on the court at once, and it's 4 on offense. And I can get really into the weeds about the different positions and what they do, but basically you've got 4 people on offense, 3 people on defense, plus a goalie. And once the offensive possession is over, then it's almost like a fast break to go the other way, because all the offensive players have to come off, and the new defense and goalie have to come on. So you're constantly running and sprinting on and off the court to switch from offense to defense. One of the biggest, so that is a huge difference between the beach game and the indoor game. Another huge difference is there's no contact really in the beach game. You get penalties, yellow cards for lack of a better term, 2 of them, and you're out for the whole game. So they're pretty serious about the contact in beach. So in some ways you can have even more scoring because there really is no contact or minimal contact. In the indoor game, you can wrap each other up, you can hold each other, you can kind of stop the play down, kind of like in water polo when you grab somebody and don't come under. The other team keeps the ball, they just have to reset. You can do those kinds of things in indoor.
Interesting. Yeah. And it's interesting too. You mentioned about the contact difference that way, and the overall pace of the beach handball and that kind of piece as well. It's interesting to me too, because it sounds like the offense always has the advantage of being up a player over the defense that way. And yeah, the goalie's out there, but there's something to be said about that, like the option of always having someone open, right? Like we look at like a sport like basketball or lacrosse or something like that, and it's like, imagine how that sport would be different if you always had someone you could throw to, always someone who's unguarded and that sort of thing that way. And it's interesting you mentioned about the speed of the line change and how that impacts the game as well, because I immediately thought of hockey, because I feel like they're changing lines all the time. And it's really quick, rapid changes. You go out there, you give your all for a minute or two, and then you're back on the bench, and then a minute or two goes by, and you're back right out in the game. So, going back to that point you made earlier about the faster pace component of the game, I think that when you're able to go really hard for a minute or two and then rest for a minute or two, your guys are usually a lot more fresh, and your girls are usually a lot more fresh when they're in the game. And they know, well, I'm not out here for that long, so I'm going to give it all I got, and then I get to chill out a little bit. So I think that it adds a different kind of element to the sport that you wouldn't find in something like, an outdoor soccer or something like that, where there's like an actual limit to substitutions that way. So I think that's a really interesting component.
Yeah, it is. It's a very short burst of activity. But I will say there's not nearly as many people. So, for example, when I was at the handball championship I was just at for beach, the rosters are limited. You only have 10 people. So it's not like you're going through complete line changes with every couple of possessions or every possession. So, when the defense does their job and they make a stop, or if the offense scores, then those defenders who are running off, they're there, and they may be sitting there for 30 seconds, and then they're right back on, depending on how quick the offense scores. And there's a shot clock, so to speak, too. So once you get called for kind of stalling out a little bit, you go. And so you're really switching sides of the court pretty much every 30 to 45 seconds. So you're sprinting off and on through sand, which kind of adds that extra fun dimension to making it a little more difficult.
Definitely. So it sounds like from an overall component of handball that way, both indoor and beach handball, there's going to be a certain energy system development requirement to the sport, in the sense that you need to have some general aerobic capacity. I think that's true for every sport, but in you saying that, I feel like the anaerobic qualities cannot be overlooked, because it's like you've got to give max effort for short durations of time or short bursts and that sort of thing. This is also a sport that it sounds like what I call the armor building is absolutely essential. So building strong, resilient athletes, and a lot of that starts with core to the floor strength, but I think to a certain extent, your arm farm days and your upper body strength is also essential as well, because any sport that involves direct contact and fast, explosive throwing of a ball, I think that there's the potential for shoulder injuries from overuse from fast, rapid throwing. And I think that there's a lot of contact that occurs up top that way. And I think that having a certain level of strength up top is certainly essential by the sounds for a sport like this. So, in my mind, the way I kind of look at it based on what you just described, I want my athletes to have a general cardiovascular fitness, but I want that for every athlete. And I'd really try and prioritize probably anaerobic energy systems development and armor building in particular for them.
Yeah, absolutely. I mean, and especially with I like that armor building. I mean, essentially, you're looking at these handball's a little unique in this way, is you've got the demands of an overhead athlete like a baseball or a volleyball, but you also have the explosive lower body demands of a basketball or a soccer. And indoor, you've got a little bit less of the on-off component. You're pretty much on. The same players are on for offense and defense. You can sub out as necessary. A little bit bigger teams, things like that. But you're still constantly sprinting, and you get a little bit of a break when you're maybe on offense and you're passing around looking for probing through that defense a little bit. But as soon as that ball is turned over, you score, you're sprinting back the other way. So you've got a lot of systems at play, like you were talking about, and they all have to be in tip-top shape if you want to perform the sport at its peak.
And on the beach element as well, I'd imagine to a certain extent you need to have some kind of exposure to training or playing on a beach element before game day that way. I'd imagine it's kind of difficult, if not impossible, to go from practicing on an indoor surface constantly transitioning to being on a beach, for game day that way. So how do you go about, or what do you think the approach would be for, exposing athletes to, sport demands that way, but on a sand moving surface as opposed to like a hardwood indoor surface that way? Or is there really a right or wrong way to go about that?
I mean, I think you really, a lot of the training for beach happens on sand. The practices are on sand. The running and things like that are on sand. Now, they'll go and they'll do weight room work, and they'll do general cardio work of long sustained things like jogging or biking or whatever they're doing. But all of the technique work, all the drill work, just like normal practice on a basketball court takes practice on a basketball court. Same thing with beach handball. They've got a court lined out. And that's how they're practicing. They're playing the game. They're moving around. They're working on their offense, their defense, their movements on sand, just like you would for beach volleyball.
Gotcha. So it sounds like a lot of the sport specific element then is kind of baked into the sport itself. And it's so interesting because I feel like that term that I just mentioned, sport specific, comes up all the time. And, strength coaches, sports PTs, they're always looking for, well, how can I make what I do more sport specific? And it's like, to a certain extent, a lot of that is just included in the sport. So if you can get them back to the sport that they're doing, or, just allow them to train the sport that they're doing, that'll kind of take care of a lot of the sports specific demands, so to speak, that way. I don't think any PT out there that wants to work with handball athletes needs to like go and put like a freaking sandbox in their clinic or anything that way. Like, I think that some people go off the deep end with these things sometimes. And a lot of times, if you just keep the main thing, so to speak, a lot of the sport specific elements tend to work themselves out.
Oh, absolutely, absolutely. I think we get a little, like you said, a little carried away with making things too specific, and they're not always going to be that way, And like I'm sure you've told your athletes, and other sports PTs have hopefully told their athletes, you can't simulate practice in a PT clinic. You can't simulate a game. You can't simulate the kind of demands that they're going to be putting on themselves. All you can do is try to make them as resilient and prepared as possible to resume those activities, and hope that they can get out there and work themselves back into those, get used to a lower body injury, getting used to being on the instability of sand. You're not going to duplicate that in the clinic. You could put them on unstable surfaces. You could do things to their vestibular systems and try to do that. You could do things to their ankle mobility and stability and hip and knee, and you could do all those things as best as possible, but it's not going to be sport specific for something like that. You just got to let them get out there and do their sport.
Right, exactly. And you mentioned that you serve, on the rehab side of things that way for national handball team, both indoor and beach that way. So I'm curious, based on the direct contact, based on the, playing style and playing surface of sand for the beach in particular, I'd imagine you probably see some pretty crazy acute and chronic injuries, on your rehab work here with these teams that way. So what kind of things do you typically see in this population, or what kind of injuries typically present to you that way?
Thankfully, for the men's and women's US teams at this most recent event, we didn't have any major things. So you're looking at tweaked ankles, tweaked knees, backs from being in contorted positions. One of the things that makes beach handball unique compared to indoor is you get a bonus point for what they call trick shots. So hitting an alley-oop, doing a 360, throwing behind the back, things like that so you're putting, some of these athletes are putting themselves into pretty vulnerable positions when they're trying to take these trick shots. So, really we dealt with a lot of just some overuse, and some pretty minor tweaks here and there. There have been worse things. One of the worst one we had was a concussion in this trip. So we did have to deal with that when the female athletes got a concussion. So we had to assess and monitor and manage that during the competition. But there have been other things. People get hit in the face, knees kicked in the face, punched in the face, things like that. You can be landed on. You might have a knee or an elbow landed on to the head or the back. So you got some acute contusions like that. But thankfully, we didn't have any major major injuries during this most recent competition.
Yeah, no, that's always a good thing. We like to avoid those major injuries as much as possible. And it's interesting because as you were talking and as you were mentioning earlier about, the different elements of sport that get incorporated into this, into the sport of handball that way, it's one of those things where I kind of realized like, you're going to have kind of like the overhead athlete shoulder presentation or what I call like the volleyball shoulder presentation where there's a whole lot of movement in it and it's not always the most stable thing in the lower back in particular. You mentioned that. Typically, I would assume that athletes just don't really know how to engage their core, and their core just kind of fires and works in weird ways because the sport itself is always changing and always evolving. No two times that you step on the field of play that way is handball going to be the same, right? Like, you might have a ton of contact one game and the next game, like you're never getting hit at all. So understanding that the core might play more of a reactive element in some games versus more of a stability element in others that way. And then on top of that as well, you mentioned like the general lower extremity stuff, the knees, the ankles, and that sort of thing that way. And that's certainly something that I see common amongst a lot of sports that require that, repetitive sprinting, the repetitive change of direction. But I think that the contact level, especially in indoor, adds a whole new level to it as well, right? Because you mentioned about the direct contact, but you also mentioned about the fast-paced speed of play that we see in indoor handball. And I think that anytime you combine fast pace with direct contact, you're going to see some gnarly lower extremity stuff.
You can definitely see a lot of that landing on people. Some some knees that are bending in different directions you might not want them to. And I'll tell you what, with the contact and indoor, with the way like I said, you have a weighted ball that you're trying to throw as hard as you can. I mean, just about every single practice and every single competition, I kept waiting for somebody's shoulder to pop out, just because of you're throwing this arm as hard as you can in one direction. It's not uncommon for somebody to stop the top part of that motion, and it's just a recipe for a shoulder dislocation. And we had some close ones, but nothing too bad, thankfully. But that was always top of mind. Facial injuries, taking a ball or a fist to the face, or an elbow to the face as you're in these scrums that can sometimes happen along the top of the court. But definitely when you're dealing with an explosive sport that's got a lot of people in one small area, you're running the risk of those traumatic lower body injuries.
Definitely. And it's interesting too, because as you were talking about different things, and you brought up the facial injuries there as well, it kind of made me think back to, when I was getting out of school, want to be, in the sports performance kind of world from a rehab setting that way. And I just really wanted to be good at lower extremity stuff. And I got into this world and I realized just how much more there is than meets the eye to the sports world. Like sports is not just lower extremity injuries. Like you mentioned, you see some facial stuff. I had a gymnast that saw me at one point for his jaw, which was the craziest thing ever. I was like, am I literally rehabbing like an athletic jaw injury now? Does that even happen? So understanding that while I think a lot of people want to get into this sports world and they think, oh, I'll just be really good at lower extremity injury management and then, everything will fall into place from there. It's really wishful thinking, but by the same token, I think that the sports that we watch are ever evolving. I think that pro football, for example, changes every year as far as, preseason versus regular season games and like different rules and different things like that. Like the sports are always evolving themselves. So as a result, the injuries that we see in the athletic population are also going to be constantly evolving. And while it's certainly good to be, deeply versed in a certain area of rehab, I think at the end of the day, you also have to have the ability to see anything and everything that can present to you because just like general population, the sports world can really have anything that happens at any given moment.
Oh, absolutely. Yeah. I mean, it's, if you want to be around sports, plural, then you're going to need to be able to do a lot of different things and do a lot of different things pretty well. Now, if you want to focus on one specific sports, baseball, football, whatever it might be, then you tend to see more of one kind of injury. If you focused on soccer, you're not going to get a whole lot of upper body injuries in soccer. You're going to get a few here and there, but for the most part, you're going to be doing upper body things or trunk involved things. But if you want to be involved in several different kinds of sports, then you're going to have to be comfortable with several different kinds of injuries, including one that I'd never heard of until just now, the athletic jaw.
Yeah, it's craziest thing, right? Like, and it's the last thing I would have expected from a gymnast of all, sports that way, but it exists. So you never know what you're going to see. And it's one of those things too that I think a lot of people in the sports space are constantly looking for, the easy way to understand and manage these things. And I don't really think there is a easy way, and that's something I really found myself personally working with the rugby team back in the spring that way is, a lot of these guys come in and banged up and beaten, battered, and bruised every single session. And that's just the nature of their sport. So it's really easy to look at it and say, well, you're not feeling good, X, Y, and Z, yada, yada, yada. You should sit out or you should rest and that sort of thing. But a lot of these athletes, that's the last thing that they want to hear. And I find it interesting to kind of balance that world of acute injury management as far as when someone plays versus when someone sits out that way. So I'm curious, have you found anything on the handball side of things or anything that you like to reference as far as when athletes should play versus shouldn't play? And how do you kind of balance and navigate that world of acute injury management that way?
I always kind of treat acute injuries as what are the consequences to this injury. Are you just going to be a little more sore if you play on it? Okay, well then let's talk about whether or not we can manage that. Are you going to do some catastrophic damage if you play on it? Okay, well then we need to have a little bit of a different conversation. So really, when you're traveling with a sports team, whether it's the work I am able to do with handball, whether you travel with a specific sports team, pro, college, whatever it is, when an acute injury comes up, that's what you have to weigh is what is this injury? How is this going to impact this athlete right now versus a week from now, a year from now, a decade from now? And that's how usually that's what helps drive my determination of what's going on. So for example, if I have a girl and we're at a tournament, we're here for a week and we're trying to qualify for a bigger championship and she rolls an ankle. Okay, well, let's assess this. Let's see how it is. Let's manage that pain. Let's manage the symptoms that go along with that as best we can. Let's reevaluate the next day. Can we play on this? What kind of damage are we going to do if we do? What kind of pain tolerance do you have to work through this? Are we playing in a medal round? Are we playing in a pool play game that doesn't really matter? There's a bunch of different factors that go into that. And ultimately, these athletes want to play. And I'm inclined to do whatever I can within my scope of practice, of course, to allow these athletes to continue to play to the best of their ability. If they're going to be a detriment to themselves or their team, and they're going to jeopardize their long-term health, then that will be the biggest determinant to me in my recommendations of what they do.
I think that's a great way to look at it. And it's interesting you kind of broke it down that way because I tend to do something similar where I kind of present what I call the risk reward ratio. So I say like, hey, this is your last game senior year. This might be your last chance to ever play the sport. Like, the reward is very high when it's something like that. But to your point, if it's just like, a general exhibition match, there's not really as much to gain from playing other than playing. The reward component to that is a little bit lower in my mind. And it's interesting too that you on the risk side of things, because I think it varies so much based on the injury, based on the athlete, and no two injuries ever seem to present the same. And I really don't think there's any one clinical prediction rule or clinical practice guideline that's really like summed up how to treat every single injury that you ever see, to the best of like to a T every single time. And I think that it's one of those things that sometimes you really just have to go on clinical judgment. And it sounds awful when I say it like this, but gut instinct and gut feeling. So you mentioned the rolled ankle that way. there's been different athletes that come to me with something like that. And I don't know what it is, but I just get this feeling that they need an x-ray. And for some of them, I'm really glad we did it. And for some of them, I'm really glad we ruled it out that way. So it's certainly one of those things where I think that you really have to balance the risk reward ratio. There's not really one right or wrong way to do it, but I think if you have the athlete's best interest in mind and understanding the health component of it, but also understanding too, at the end of the day, this is an area that I will occasionally tap out on and say, hey, look, it could be this, but it also could be this. Like, we really need to get something else to confirm it. And I think that's where having the ability to get someone into another provider quickly, whether that's for x-ray or additional examination or so on that way, can also go a long way as well, because it can kind of further guide your clinical decision making, so to speak. And at the end of the day, we can do all these different CPRs, like I mentioned, and say like, well, there's a 70 some percent chance probability that it's, bony involvement, or we can just get an x-ray and rule it out from the start. So understanding that there is certainly a time and a place for the acute injury management to bring in other disciplines and other sports elements, I think, or other medical elements, I think, to kind of help guide that process a little bit more. And I find a lot of the athletes actually get a little peace of mind from it too, because if things come back negative, they're like, okay, this is good. It kind of gives them that extra mental vote of confidence, I find.
Absolutely. And to your point, like, we come out of school, we don't come out of school with specialties. We come out of PT school as generalists. Maybe we're orthopedic, maybe we're neurologic, maybe we've got this area of focus that we've gone through school, but you come out as a generalist. And then like I was lucky enough to do a sports residency, so then I got to focus in a little bit more. But you don't learn these acute management things in school. It's just not part of the curriculum. You have to learn these things as almost like a trial by fire if you're going to be involved with sports. And hopefully you have some really good mentorship around you when you're first getting started to help you hone in these skills. And then, I got lucky enough with my work at SMU of a great sports medicine team around with the physicians and the athletic trainers, and we all get along really well. There's not a whole lot of pissing matches with territory and things like that. We all recognize everyone's skill sets, and we can come together and make these good determining decisions on these acute things, or fast forward that into return to play things, and we make those as a group, sports medicine group decision for what's best for those athletes, taking all those things that we've talked about into account when you're making those decisions.
Yeah,
And yes,
exactly.
and that does help the athlete. They realize, hey, this isn't one person making my decision. I have a whole team of people who have my best interest in mind.
That
I
and
think I
it
should listen to them.
definitely, and it allows you to kind of leverage everyone's unique skill set to the best of their ability for the athlete in front of you, right? So, give an example. I absolutely suck at taping. I have no idea what I'm doing half the time. I'm known to like look up tutorial videos like a couple days before if I know I'm going to tape someone. Like, I know a few basic KT tape type things and a few basic Luco tape type things, but like that's about as far as it goes. It's not something I do regularly. But there's ATs that tape dozens of athletes day in and day out. So if athletes need taping, I'd rather them go to their ATs who really know what they're doing with that, as opposed to going to me who really has no idea what he's doing. I didn't do too
Mhm.
well in elementary school arts and crafts, and I kind of compare my tape jobs to like elementary school arts and crafts. They're going to function okay, but they're not going to look the best aesthetically. So understanding that, there's a time and a place for everyone in that rehab acute injury management piece. And that also speaks to the point too, in handball in particular as a sport, as you mentioned, it's not like the mainstream sport yet. It's not as big as football or baseball in America. So understanding like your resources might be limited, but you really have to get creative and work with what you have. And if you don't know, then, it's a great time to kind of figure things out. So I really measure the success of a clinician by their ability to figure things out when they're in a high pressure situation, because we're all going to face those high pressure situations, whether that's in an eval when you're in office or when you're managing, or covering a acute injury type of event at a sporting event that way. And I think that your ability to problem solve quickly and act in the best interest of the athlete can really set you apart there.
Yeah, I agree. I mean, when if you're traveling with collegiate athletics, especially if you're traveling with football, I mean, you've got a huge, sometimes 120 person traveling party, and you've got, depending on the school setup, you might have one or multiple physical therapists, several athletic trainers. Usually, in a lot of places, the director of sports medicine travels with football. You've got student athletic trainers, you've got interns, you've got usually at least one orthopedic physician that's traveling. So you got these huge teams. And when you're doing things with some of these smaller sports, like handball, for example, when I travel with them, it's just me. There isn't a team of people who go. There's not an athletic training staff. There's not a physician coverage. There's me. I am most medical. The event venues are supposed to have these kinds of things, but they don't always. This is a sport that's much bigger in Europe and South America than it is in the United States. And the simple fact is a lot of places don't have the same kinds of athletic protections that we have in the United States and that we require for our athletes here. So there are times when I might be one of the most medical people in the entire venue, just depending on where we might be playing. So being able to manage that, roll with that, and like you said, I mean, I've learned and forgotten how to tape an ankle. I don't even know how many times at this point, and I have to review it every time I'm getting ready to travel. And if I've got some of the girls who need specific things and they've used it before, I'll ask them, okay, what have you done in the past that's worked? And they may have a specific tape job or a specific something that they've done, and I'll try to replicate that as best I can. Or if I feel like, maybe we can work with something else, and I'll explain my rationale for that, and maybe we'll go in a different direction. But it can be difficult to learn these things and do these things when you don't have the full team around you. But you still have to be able to function. You still have to be able to get these athletes to perform.
Yeah, and ultimately, I think if you can perform in that kind of environment as a clinician, you can perform in any kind of environment. I really value the clinician's ability to perform in an environment where they have minimal to nothing and they're still able to make it work and make it happen, as opposed to the clinician who's always had everything in their toolbox that way. And, it's interesting because I know a lot of people make the argument nowadays that, we need X, Y, and Z. We need all this tech and this cool stuff that way. And, I'm certainly guilty of bringing some of it into the clinic space myself, but I ultimately kind of think that you don't necessarily need all of it all the time. In fact, we worked for quite a long time with pretty good outcomes without a lot of it. So understanding that having the ability to work with nothing, and assume that you're not going to have any tools to work with that way, but you still have to provide high level care for athletes, and knowing that you can do that, having the confidence to be able to do that, I think can really set you apart in this space. And I think that, with that in mind, that can certainly set someone up for success clinically with handball. But I think that handball as a sport could be applied much more as well and have an impact on, whether you're a clinician that way or even if you're just an athlete that way. I think that the sport presents a unique opportunity for athletes to move in different ways and kind of like mix up their training, so to speak, in the sense that I think a lot of people make the argument nowadays that our athletes are becoming too specific or too honed into one sport in particular, and they need to just move more in general ways or in a lot of different ways. And I think that having the ability to mix other sports into that one sport's training that way actually does that quite well from a general physical prep standpoint. And you mentioning about, the setup that goes into handball, and it didn't sound like that much equipment. In fact, most sports centers probably have 2 indoor soccer goals and some indoor space to rip something comparable to handball. It doesn't have to be an exact replica of the game, but I think it would allow a very different kind of training stimulus for athletes that could be really fun, really competitive, and allow them to work on a lot of the qualities that carry over well to other sports, but doing so in a way that is a little bit different than they're used to, and kind of exposing them to new demands and different movement patterns that way.
It's a great developmental sport. In the countries where, in the regions where handball is a big part of the athletic environment, these kids are starting this in elementary schools. It's part of their elementary school curriculum, kind of like as popular as soccer is here for the youth. These kids are playing handball, especially over in Europe, and it's part of all of their athletic facilities. And you're right, it doesn't take much. It doesn't, I mean, it's similar to soccer, really. I mean, you just need 2 goals and a ball, and the rest of it you can tape off from there. So, being able to incorporate this in at a young level, you're teaching kids how to run and sprint and change direction and jump, and you're teaching them how to throw, and you're teaching teamwork, and you're teaching them how to think and move, both in an offensive and defensive way, and how to kind of move their upper bodies and lower bodies in different ways and dissociate that upper body and lower body. It's just a really good foundational sport to teach all of these big, gross, athletic foundational movements that we're trying to develop in our kids. Plus, if you can get them doing something that they enjoy when they're young, then they're more likely to continue to, if not play sports, at least be up and be active. So from an early age foundational component, I think handball has a lot to offer. To a little bit more of what your point just a second ago when you were talking about specificity and things like that we're doing. It doesn't have to be just kids. Anybody. You could play handball as an off-season sport for just about anything. Football, volleyball, soccer, basketball. Those same things still apply. You're still putting new stresses and new movement patterns onto the body, and you're forcing these athletes to get out of their normal repetitive athletic comfort zone and challenge themselves in other ways, and that's elasticity to their athleticism is only going to translate to their quote unquote main sport more. And who knows, they may even find a new main sport and fall in love with handball and pursue some options with that as well.
Right. Or, perhaps they finish out their eligibility for their main sport, and then after college, they pursue handball as their sport, right? I see that a lot with the bobsled side of things and the skeleton side of things as well, as most colleges don't have a bobsled team. But athletes can go on from, maybe being a 100-meter sprinter that way, transitioning over to the bobsled events after college, and, continue their education or continue their athletic career in a different way that way. So I think it certainly opens up that door for more potential opportunities that way. And to the point too, on just overall movement exposure that way, athletes, from what I've seen in my clinical practice anyways, are the best compensators for poor movement. It seems like everything they do, they're trying to solve a new movement problem. Every single play in a sporting event, every single minute, it's just a new movement pattern, so to speak. So I think that while it's really good to reinforce specific qualities that are, going to be seen across a specific sport, I think that in general, having an athlete have the ability to solve a variety of movement problems and have a large, what I call movement vocabulary, is essential in the modern day athlete that way. And I think Patrick Mahomes, love him or hate him, is a great example of that and the impact he's had on the football space that way. Like, he's hitting passes and doing stuff that no one has really ever seen before. And I look at him as a great mover, for lack of a better way to put it. He's just able to move his body in so many different ways and solve so many different problems with so many different movement strategies that way. And I think the more you expose your athletes to a variety of different sporting demands, the more you're going to be able to develop that characteristic in them.
Absolutely, absolutely. And I want to take it aside for one quick second, because I want to go back to what you said earlier about these athletes being such great compensators. There was a girl that I was working one of my first team camps for the indoor team with handball, and had an athlete who was complaining of shoulder problems. This girl, she had an absolute cannon for her right arm, and she was having some right arm troubles. I'm looking at her shoulder. We're looking at things like you may have a torn labrum. This is something that you're going to have to probably get further examined when this camp is over. We'll see what we can do to get you through the rest of camp. And I was watching her specifically move around, and we were trying to figure out how we could modify some of her stuff. And through this, I noticed this girl did not use typical patterns. Most people, if they're right-handed, if they're going to go for something powerful, they're going to jump off their left foot. And it's that right arm, left foot, that diagonal pattern. And she did all of her work all one-sided. She would jump off of her right foot for power and then throw with her right arm. And so she was doing all this work. She wasn't able to use the rest of her body to help her. So her shoulder was just taking enormous amounts of stress and abuse because she didn't move in a proper pattern. And here I am in the middle of this camp with this girl who's been playing handball for over a decade. And she's 23, 24 years old, however old she was. And I'm trying to teach her how to move and jump off of her left foot and throw with her right arm. And she was athletic enough to start to get it down, but it just blew my mind that this girl has been playing for a decade and she doesn't know how to move properly. And she was compensating so well for it that you couldn't really see it unless you knew what you were looking for. And unless you were watching her move around on the court to see where she was generating her force and her power from. So it takes a lot. And sometimes it takes an injury before you finally realize, oh, this athlete has been compensating really well, and they've got a lot of things that they need to start working on, or they're going to have a very, very short career.
Yeah, no, that's a really interesting point. And that case in particular speaks like volumes to that compensation ability that way. And it's so interesting because I think, going back to PT school for a second, they teach you all these norms and different values to look for and that sort of thing. And then you see athletes who have absolutely none of them or the extremes of them. And you watch what they do on the sport, on the field of play that way. And it's like, how are they able to do that when they look like this, an isolated exam that way? So I think that having that understanding that, not everything is always going to look quote unquote optimal from the, examination eye, but there's things that we can do to certainly, adapt how the athlete plays or understand how the athlete plays at a deeper level and then kind of work from there. And, the other piece you mentioned about jumping off the right leg and swinging through the right shoulder or throwing through the right shoulder repeatedly, it made me think back to a podcast we did recently with another SMU guy, Anthony, there, talking about open chain rotation in particular, that way that we see with volleyball athletes all the time, in the sense that they jump up and then have to generate power, but their hips are open chain because they're in the air. And I think that's another unique consideration for the handball athlete as well, in the sense that you're jumping off the ground and throwing repeatedly. So not just having the ability to train rotational power, but train rotational power in an open chain sense, because there's a huge difference between, your golf swing or your baseball swing or that sort of thing, where your feet are closed chain and on the ground, versus a volleyball kind of swing or a handball kind of throw that way, where you're literally jumping in the air and then generating rotational power without the legs on the ground, so to speak.
Yes, absolutely. Drawn that comparison myself when I've been talking about this with other people, is not only do you have to be able to generate this force and power without using the ground, you also have to be able to stop all that force and power without using the ground. There's very few sports that, volleyball, handball, maybe water polo, but there's not very many sports where you are generating and controlling these massive amounts of force without being able to use your lower body or the ground to help you do that. And it does present some unique challenges, like you said, to not only the strength, but to the rehab and the acute injury management of these kinds of unique overhead athletes.
Yeah, no, definitely does. And I think, going back to how we started having an understanding of what the sport entails, what it looks like is, the fundamental building blocks of rehab in this sporting world is if you don't know what goes into the sport and what it looks like, then you're ultimately just going to be guesstimating at things. And we can certainly do better than that.
Absolutely, absolutely, yes. And that kind of goes back to, the profession as a whole, recognizing where your limitations are and being able to have a network around you say, you know what, hey, I don't really know, I'm not really familiar with this. And you either got to have your patient or your athlete kind of educate you on what you need to do, or reach out to a network that can help you. I mean, there's still, I like to think I've got a pretty diverse athletic background, and I at least know the generalities of pretty much every sport that I've ever run into in this world, but it doesn't mean I've played everything. And still to this day, I'll bring an athlete in and I'll think I have this great idea of something that I want to do with you that I think is going to be able to translate to sport. I think it's going to be able to do this, and I'll take them through it, and I'll say, okay, how does this feel? Does this is this kind of mimicking like a tennis player who was having some trouble with the serve motion, and I took him through this exercise that I thought was going to be helpful, and we went through it, and he's like, it doesn't really feel like it's doing what you think it's going to do. I was like, okay, perfect. You gave me the feedback. We're going to move on to something else. And we came up with something else that did give him the kind of feedback that he was looking for, that he needed. But you have to have a basic understanding of what you're doing before you can get into those kinds of nuanced things.
Yeah, no, absolutely. And that could become a whole podcast episode in itself there, having the fundamental building blocks and the foundation of understanding what you're doing and what impact it has on the athlete or on the person that you're working with, so to speak, from a PT standpoint. Because I think a lot of times we undervalue or underappreciate the effect that we can have on someone that way. But Matt, I feel like we've covered a lot of ground as it relates to handball today, from the sport itself to the acute injury management side of the sport that way, and so on, and incorporating the sport into other sports, for lack of a better way to put it as well. Is there anything that we missed as we were chatting, or any other kind of closing thoughts or closing remarks you have that way?
Just kind of summarizing things up. I think that some of the takeaway messages, thinking outside the box a little bit with your athletes, and finding different ways to challenge them and different ways to challenge their bodies and their athleticism. Looking at maybe some of these more quote unquote obscure sports, at least as far as the United States is concerned, and then also being able to kind of see and appreciate the beauty of some of these smaller sports, and what kind of a role and impact they can have in development from a youthful age all the way up through collegiate and professional. And just kind of understanding that. And then I think just from a general PT profession standpoint of just kind of understanding what you can and can't do, kind of knowing like you don't know what you don't know. You can have some of that, but you also, when you're dealing with these athletes and their livelihoods, that's not going to always be good enough. You have to know what you're doing, and you have to understand what these athletes need. And if you don't have that, don't be afraid to get some help in fully understanding that and making some of the decisions with this. We don't
Yeah.
always have to do everything ourselves.
Yeah, no, absolutely. I love those points, Matt. And for people who want to find out more about you and get in touch and hear and learn more about the handball sport, but also what you do on your end of things that way, where can they find you at? I know online is like your main presence, right?
Yeah, yep. So I do have my own private practice here in Dallas. It's called Hubbard Functional Wellness, Hubbard. Website's hubbardfunctionalwellness.com. And I do have my socials that I don't have memorized because I'm old, and I'm not as in tune and intuitive with these things as some of the younger people on this thing. But I have my personal Instagram is dr.matt, Hubbard.pt. And then we also have our company Instagram, which is hubbard.functional.wellness. So you can find us on those. And if you're interested in learning more about handball in general, then USA Team Handball has a great website out there. with lots of good information. They even have programs to provide equipment if you're starting up clubs, or if you're starting up school programs, things like that. So there's a lot of good accessible information through our own national team.
That's awesome. We'll link to all of that in the description below. That way, if you didn't quite catch it, you can just click there and see all of those resources relating to Matt and everything that him and his team are doing, but also in relation to the sport of handball as well. Matt, this was awesome, man. I really appreciate your time today.
Thank you, Dan. I had a great time. I appreciate you having me on.